everybody, it's Jenny from MedEd again. So the next procedure I'd like to do with you guys is called passive range of motion. And on your assignment sheet, it may just be say Prom, P-R-O-M. That means the residents need us to do the joint movements for them. So you do your initial steps, get report from your resident, from your nurse, ask about your resident's needs, abilities, and limitations. Knock on the door, wait for permission to enter. Call them by the name they prefer, identify yourself by name and title, and explain what you're going to do. Find and gather your supplies, close your curtain drapes and doors, wash your hands, wear gloves when dealing with body fluids, and use good body mechanics. So we're going to begin range of motion at the shoulders. The first thing I'm going to do is check for rats. So we came up with the word rats because you kind of have to wrap your hands around to support the joints. We're checking for W is warmth, R is redness, A is just and, P is pain, S swelling. Because warm, red, inflamed joints are usually arthritis, keeping the movements going could cause further damage. So if there's any redness, swelling, pain, notify the nurse, or warmth continue only if instructed. So my residents in good body alignment, I'm going to start with the shoulder. Now the shoulder can move 3 different ways, 5 times each movement. So support the joint just above, just below, and the shoulder goes up and down. 1, 2, 3, 4, and 5. It goes side to side. Abduct, adduct. 1, 2, 3, 4, 5. And it can also go in a circular or rotation. 1, 2, 3, 4, and 5. Next joint is going to be the elbow that only moves one way 5 times. Extension and flexion. 1, 2, 3, 4, and 5. Now Andy doesn't like to move her wrist so well, but I will do the best I can. For the wrist, we're going to go up and down 5 times. 1, 2, 3, 4, and 5. And then we're going to do a circular or rotation. 1, 2, 3, 4, and 5. Now, when you're moving the fingers, a lot of my students were getting cautioned or getting stopped because they weren't moving all 3 of the joints. So when you move the fingers, I call this kind of like a worm, or you can call it a wiggle, whatever makes you happy, but you have to move all 3 of those joints. So you move the fingers this way 5 times, and then in a circular motion 5 times. So we're going to worm it 5 times, and then we're going to wiggle it 5 times, and you would do that for all the fingers and the thumb. Now we're moving down to the lower half. Expose only what you're working with. The next joint I'm going to work is the hip, and the hip moves just like the shoulder, 3 different ways. So the hip moves up and down 5 times. 3, 4, 5. In and out. 1, 2, 3, 4, 5. And in a rotation. 1, 2, 3, 4, and 5. The knee is just like the elbow. It only moves one way. Extension and flexion. 1, 2. Now let's say my resident says, hey, 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 that hurts. What should I do? Stop. Tell the nurse there was some pain with whatever joint. This was the knee. Do what the nurse tells you. So in this scenario, the nurse said skip the knee, so I'm going to skip the knee. Going down to the ankle, 2 ways, up and down. 1, 2, 3, 4, 5. And in a circle, 1, 2, 3, 4, 5. And then you would wiggle the toes just like you did the fingers. Once you complete one side, you would go to the other side and do the exact same thing. After your procedure's complete, make sure you do those final steps. A, check alignment, make sure they're comfortable. B, make sure the bed is in the lowest position, side rails as appropriate. C, make sure they have their call light and water. Make sure they don't need anything else before you leave, and make sure you say thank you. Find and gather your supplies, clean them to company or facility policy. Open the curtain drapes and doors according to their wishes. Wash your hands, do a visual safety check, report unexpected findings to the nurse, and document. Thanks for watching.